Hello, my name is Ameenat Lola Solebo, and my patients call me Dr. Lola. I am a paediatric ophthalmologist at Great Ormond Street Hospital, and I'm an epidemiologist at the UCL Great Ormond Street Institute of Child Health. I was a medical student at St Bart's in Royal London, now Queen Mary, University of London. And during my time at medical school, I did an intercalated BSc. It was a really interesting topic, but it was not patient facing. So at the end of medical school, in my mind still, I was going to be a full-time clinician. But then I was lucky enough quite early in my ophthalmology training to be exposed to what life was like for a clinical academic and the positive impact that they could have on the wider population, but also just how interesting their career was and how much enjoyment they got personally, in a really selfish level, how much enjoyment they got and what their well-being was. Incredibly busy, but also incredibly fulfilling in a different way and stimulating in a different way from their clinical work. So that's what inspired me relatively late in my clinical career to go into research. So midway during my just after ST3, in fact, after ST4, in fact, I took 3 years out to PhD. And then when I came back into full-time clinical practice, I looked for research funding that would support me having a clinical academic role going forwards. My specific areas of interest for research are really all about the determinants of outcome for children who have or children who are at risk of sight loss, sight impairment. And understanding those determinants with a view to deepen the understanding of the disease process, the natural history, but also by understanding the determinants of outcome or the determinants of risk distribution, you really start to put together what the intervention might look like to improve outcomes, reduce the risk of disease. So my interest is very much in deepening that understanding, but also in the implementation of interventions derived from those understandings to really make a positive impact on the community at risk. I think the greatest challenges in my role tend to be balancing it all. And I think anyone really in academia will tell you that one of the challenges is balancing both sides of work. Clinical care is really demanding, and the clinical environment, whilst being fulfilling, as I said, um, there are just lots of pressures and lots of areas that are outside your control. So you do find yourself constantly giving time and giving of yourself to the patients who deserve that kind of dedication. But then you've also got to make sure from an academic point of view that you're always scanning the horizon, understanding where your research fits in, understanding where the funding might need to come for your next project, as well as delivering on the project that you've got and also looking after the team that you're building. So that balance of making sure that you are being as effective, as impactful as you can as an academic, whilst also making sure the same is true for yourself, a clinician, that balance is probably one of the most challenging things, but it's worthwhile. I am lucky in that the various sides of me that enjoy various different things can be fulfilled. I keep on using my F word a lot, don't I? So, for example, I really enjoy gaining the trust of young children in my clinic who might come to me quite apprehensive because eye disorders tend to happen in children who have other disorders. They come to hospital a lot, they have blood tests, they have interventions or tests that might be painful, and it takes a lot to get their trust. But because most of the children I look after tend to have a chronic disease, I see them again and again and again. You get to build up that relationship, and it's really precious to me. The fact that those children give me their trust, it's one of the best gifts ever. And living up to that is, what sometimes gets me out of bed in the morning. Out of bed in the morning. But on the other hand, as well as that lovely patient contact, I really like data. Giving me a data set to get into and to clean and to generate information. When you're running an analysis and you're the first person in the world to have that answer to that question, because you're sitting there running those analyses and understanding also where your data come from and where your data originate, and the insights that you can have when you're going through your data. Those are things that I enjoy the most. One of the reasons that I went into the current research field that I'm in, so I'm currently doing research on uveitis, which is a chronic inflammatory eye disease that is rare in childhood, but really impactful. And one of the reasons why I went into this clinical area is I was sitting in a clinical room as a fellow. It was actually my last year before I got my CCT, before I qualified as a consultant. And so many of the questions that the families were asking, the clinician was saying, like, we don't know. We don't know. And you could see the impact of this uncertainty on the family. So to be able to generate useful information for the counselling of those families, I think that's really been one of the most positive outputs from my research. The advice that I give to someone who is thinking about a career in health related research is to find two things. Find yourself a mentor. So a good mentor will really be able to sit down with you, understand and help you to come to understanding about what your strengths might be, what your passions might be, how to lean into those opportunities. But also, you need to find yourself a sponsor as well. So academia can often seem like a really closed off world. And it can often seem that those people who are able to bang their drum the loudest are the ones who get the opportunities first. And some people, particularly if they might come from underrepresented groups, whether that be due to personal characteristics, whether that be due to the clinical community you're part of, those from underrepresented groups in research can't really see a way in. And what a sponsor will do is something a little bit different from a mentor. What a sponsor will do is will be able to hook you in to conversations, or put you in situations, or put you in rooms where you'll be able to get opportunities to really advance your career. So it's a little bit different from mentor. Both those things are really important, but get yourself both of those things. They might happen in the same person, of course, but those are really the two relationships that will be key to you. But also lean into what you enjoy. It's a really long path. It can be really onerous. Make sure you understand what you enjoy and where you're going to get your joy from, because that'll really keep you going. So I was very lucky to be introduced early in my clinical academic career to the person who became a mentor and then became my PhD supervisor and is now a colleague at the institute where I work, and that's Professor Jidni Rahi. She is also a woman. She's also from ethnic minority background. But the lovely thing about Jugnu is that she has such an excellence and clarity and strength of her science that one of the things that people often that people often worry about is being seen as being someone who doesn't belong in that space. But when you have someone who is a sponsor or a mentor, or however you want to label that relationship, who really just shows you what excellence looks like, it can be incredibly inspiring, especially if it comes in a package that's also warm and human and approachable and accessible, to let you know that excellence is a thing that is embedded in human qualities, and wanting to share that excellence and lift other people up. That can be quite powerful. So I was really lucky to come across that person, be introduced to that person early on in my clinical academic career. One of the misconceptions that it might be worthwhile really squishing when it comes to clinical academic careers is there's only one type of clinical academic career. The person who is sitting at a microscope, sitting with a pipette, sitting doing wet lab, quote unquote science. That is really impactful science. But all clinicians in the NHS should be involved with research to some degree. should be supported to be involved with research, should be encouraged to be involved with research. So I think that one misconception is that there's only one model of, being a PI, running your own research lab, having this big team at the unit, only occasionally going into the ward, only occasionally going into theatre, into the clinic. There's real diversity of involvement when it comes to how much research you do, what kind of research you do. And all of us really who feel that evidence is important when managing our patients, I think that's all of us. All of us play a role in helping to support that evidence base. We do. So, yeah. It is never too late to be involved in clinical research. You can be relatively senior in your clinical career, whatever stripe of clinician you might be. There are opportunities. It really is worthwhile just looking out for people you can have interesting conversations with. That conversation might not go anywhere, but it really might be the beginning of you having an expansion of your horizons when it comes to the career you have and the working week that you have, and the benefit that you can have as well to your patient populations, not just the ones that you see, but the ones you might see in the future, the ones that your colleagues across the UK, across the world will see in future.